What you know about sciatica is probably wrong. You probably don't actually have what you think you do. In this video, I am going to explain what sciatica is, what causes it, why most people actually have something else, and how to determine if you truly have sciatica. Sciatica is a broad term referring to pain down the leg. The name came about because the sciatic nerve is a large nerve that runs out of our spine and down the leg, and when irritated, can cause pain in that path. But the problem is the name is too broadly used. While irritation of the sciatic nerve can cause pain in the leg, it is far from the only thing that can. In fact, it is actually one of the least common causes of pain down the leg. Some sources estimate that only about 15%, so a little more than 1 out of every 10 cases, is actually due to sciatic nerve irritation. The majority instead are due to something called referred pain, where, simply put, irritation of another joint, like your hip, causes radiation of pain down into the leg. For people and medical staff not specialized in this area, it can be hard to tell the difference. And so they generically label everything down the leg as being sciatica. Unfortunately, this is not ideal because it means we often end up treating the wrong thing. Through the rest of the video, I am going to explain the different causes of sciatica and explain how to differentiate it from that referred pain. Let's talk about sciatica to start. First, we no longer actually use that term. Instead, sciatic nerve irritation is subclassified into 2 different categories based upon symptoms. First is radicular pain, and second is radiculopathy. Here's the difference. If you have neuropathic pain down the leg, burning, tingling, electric shocks, and importantly, not a dull ache, then you get the lumbar radicular pain label. If you have muscular weakness or reflex loss, you get lumbar radiculopathy. Importantly though, this is for true weakness. You can seem weak without being truly weak if your pain is preventing you from strongly contracting the muscle. Now, importantly, you can have both radicular pain and radiculopathy, or you can have just one. But it is important to identify what exactly is going on because it gives us a much better idea of how severe your case is and how we need to treat it. Whereas the generic sciatica term you hear tells us honestly nothing. Now, why does sciatica, i.e. lumbar radicular pain or radiculopathy, happen? Although not exhaustive, it's easiest to think of it as happening due to one of 3 reasons. A, compression of the nerve, or B, inflammation of the nerve, or C, impairment of the nerve by some other health condition or medication. Let's talk about compression first. This can happen at a few different locations. First is high up in the spine where the nerve roots first come out from the spinal cord. If you have a disc herniation, this is where it compresses the nerves. It hurts into the leg because those nerves later converge to become the sciatic nerve. People know that herniations can compress nerves, but they are not the only thing. In older people, arthritis, so think bony overgrowth, can cause compression too. While in younger people, small fractures of the spine can cause the vertebra to essentially slide forward and compress the nerve, as in spondylolisthesis. Then in rare cases, we can even get cancer, i.e. tumors that grow and compress on the nerves. The second location where compression can happen is in your glutes or your butt. When you sit unevenly on a hard surface, or when you stay on the toilet for too long and your leg gets numb, that is what's happening. Usually the compression here is temporary, like that, but there is debate that conditions like piriformis syndrome may cause a longer-term compression. And the third location is lower down on the backside of the thigh or knee. The causes here are honestly pretty rare and probably not your problem, so we won't spend time on it. I just wanted to mention it for completeness sake. Next, let's cover B, inflammation. This is not something that happens always on its own. For example, if you have a herniation pushing on the nerve, it's likely going to irritate the nerve too. And so your pain in that case comes about due to a combination of inflammation and compression. But I make this a distinct category because you can have inflammation without getting compression. This is why you can get sciatica even if your lumbar MRI does not show any compression. The inflammation is likely the cause when you do something like twist your back funny, lift heavy, etc., and suddenly get sciatica, but your MRI is totally clean, meaning no compression. The thought here is that you have done something to irritate the nerve. Maybe you heavily compressed the nerve root in your back when you were lifting heavy squats or lifting weird. That alone can inflame the nerve for a while, even if there is not continuous compression down on it. But realistically, it's kind of hard to prove that as the cause. Now, what about C, those other health conditions or medications? This is a huge rabbit hole we are not going to go down into because it would require an entire other video. What I want you to know is that nerve pain in the legs, so neuropathy, can occur for a ton of different reasons and different health problems. Diabetes is the most common cause, but certain medications like chemo drugs can do it, as can autoimmune conditions and even nutrient deficiencies. Now again, it is very unlikely this is your problem, but it's helpful to keep on the radar. Let's talk about what we know about referred pain and how it looks different than radicular pain or radiculopathy. In the most simple terms, referred pain is when impairment of a tissue causes pain to happen at another area that is unrelated to that tissue. The example you probably know is how people who get a heart attack often get pain down the arm. That's honestly pretty weird, right? Because your heart and your arm are very different things. But it happens because as the nerves come back toward the spinal cord, they converge together, meaning a nerve near the cord carries information from multiple body parts. And those signals can get essentially crossed, leading to pain in areas that don't make a lot of sense. This crossing can happen with many organs, tissues, and joints, and it occurring is the most common cause for what people classically think of as sciatica. But here, the problem is not impairment of the nerves in the spine or the glutes. Instead, what happens is that some part of the joints instead of the hip, lumbar spine, or sacroiliac joint become irritated. Those joints then refer pain down the leg, either partially or sometimes even all the way down into the feet. Now, because this is not due to nerve irritation as lumbar radicular pain or radiculopathy is, but instead due to irritation of joints, it is treated very differently. So we do not use the same medications, surgeries, or even PT exercises that we would in radicular pain or radiculopathy. Instead, you have to identify which area or body part is causing that referred pain, and then treat that instead. So how do you figure out if you have radicular pain / radiculopathy, or if you have referred pain? For the most accurate answer, you need to go see someone who specializes in treating pain. However, here is how you can get a general idea. First, assess the quality of your pain. Radicular pain has a distinct sensation because it arises due to nerve irritation. It will be some mixture of burning, tingling, shooting, electric shocks, and numbness. In contrast, referred pain is dull, achy, and may feel deep in the joint or muscle. Dull or gnawing pain is the most classic description people use. Second, look at the location and the path of the pain. Radicular pain will travel in a fairly thin, distinct line. You can usually trace it clearly with your finger. However, it will not be much wider than your finger or a pencil. This is because nerves are fairly thin and they follow a fairly clear path. Referred pain will instead be vague and pretty hard to clearly locate. Classically, people can identify a core area or spot from which pain or discomfort can then radiate and spread out. But they have a hard time clearly identifying where the discomfort travels or ends. Rather than being able to trace it with a finger, patients will classically point to a core area, but then have to use most of their hand to kind of identify where the pain is. They have to go like this, they can't just go, hey, it's right here. Third, check your strength and your reflexes. This is hard to check on your own, not only because testing your own reflexes is challenging, but also because it's hard for you to accurately tell whether you have true muscle weakness or are feeling weak because your pain is limiting you. The point is, if you have reduced reflexes and clear muscle weakness, then it is more likely to be a radiculopathy, and so not referred pain. Though both can also coexist at times, it's not always a perfectly clear picture. As mentioned, this video is not a definitive guide. Realistically, you cannot assess yourself in the same way a professional would. But I do hope the video answered your questions, and good luck with the rest of your recovery.